path of life which you choose. Some of you maybe say, oh, I want to just work here and I want to serve my motherland, which is absolutely fine because the work is needed here, and very wise people they do the work where it is needed. But most of you or some of you may say, I'm going to go abroad and go and seek higher education, which is absolutely a good reason. You want to equip with the evidence-based, scientific, up-to-date healthcare. And some of you may say, oh, I want to make some money. If you want to just make money, I would say add some extra degree to that, like an MBA. And you should equip yourself with the education of finance as well. It's a very common trend to do MBA with the MBBS. It'll make your life easier, and if you're goal-oriented, it'll make your goal to make money also easier. There's nothing wrong to make money, because before you become the philosopher, you need to have money in your pocket. What I would like to tell you about seeking residency is your eventual goal. You would have to sacrifice a lot of stuff. The first thing I would say, once you take the residency, there are a few things which you need to know. You may not get the residency of your choice. Maybe you want to become a surgeon, but there are very few specialties where the foreign grads are entertained. Medicine, family practice, those are the easier things. Psychiatry used to be easier, but now it's getting tougher because of the pandemic and the mental well-being education and all that. There are few specialties like interventional radiology and surgery, all the surgical specialties, cosmetic surgery, dermatology, they're very hard to get into. So you may have to sacrifice at that level. You may not like to, like whatever you want to get, you may not like to get it. Or you may not be able to get it, even if you like to. So my goal is that to place you in those institutions where it increases the chances. It's a dream, it's the thing which we have to struggle together, but maybe I'll be able to help you. As the team, there are people here, and then I, being in the US, will have connections and will help you to just navigate you and direct you in that direction. Let's say after the residency, you have to find the job. There are few things I would like to tell you. Once you are finding the job, there are 5 things you need to know, which I was not told and I had no concept of that. Once you find the job, there are 5 things. So number 1 thing, malpractice. Malpractice is something which is you have to seek, which you have to pay before even you can practice. Everybody has to get the malpractice. Depending on the surgical specialties, depending on the depending on the medical specialties, sometimes it can vary from 50K to 100K. I'm an OBGYN and my malpractice is 50K plus.